Welcome to Village in Motion. I'm Clint Lambert. I'm the host today. And we're going to be talking about philanthropy, and we're also going to be talking about things going on at the medical center. But first, the medical center, we have two guests with us this morning. We have Dr. Sonia Bethel, who is the director of the medical center, and she's brought along a guest with her, Dr. Sarti, who is our podiatrist here. And I'm looking forward to us talking about foot care in the summertime. Welcome, ladies. Glad to have both of you with us.
Thank you.
So how are things going, Dr. Bethel?
Well, things are going very well in the medical center. We're staying as busy as ever. Just wanted to make a plug for folk to continue to ask about their Prevnar injections, which is a pneumococcal vaccine. We've given over 800 so far. And our next campaign is going to be to extend into assisted living and the long-term care units and provide the Prevnar for that group.
That's great. I mean, and the shot wasn't bad at all. I've had it, and it, nice, easy shot, and
you survived.
I survived, and everything went well. So
good.
We're very glad to be able to do that. And we finally got Medicare to pay for it, right?
Yes, exactly. So you're just signing a consent form, but there should be no out-of-pocket cost to the resident.
Good. And you brought Dr. Sarti with you this morning, and what's the reason for that?
Well, we're here to talk about how age affects your feet. And of course, there are multiple categories that are affected by aging. The skin, of course, the bones, and the circulation. So those are the three broad categories that are affected. So when you think about the fact that your feet have been a part of your body for as long as your body has been in existing.
Hopefully.
So there are some changes that would be expected, like you have some decrease in the connective tissue, the soft tissue in your feet, which means that there's less elasticity. You have some decrease in how the tendons function. You have maybe less fat underneath the surface of the skin. And you might also have decrease in cell turnover. So because things just slow down naturally with aging. So you say, okay, so what does all that mean? So that means you might have more problems with dryness of your skin. You have more corns and calluses, so that when you're younger, because you have cushioning, even if you have the same shoe, you have the same fit, the fact that you have more protection when you're younger prevents you from getting those. So you have more problems with corns and calluses. You have more problems with the skin drying out just because the cells don't turn over as quickly as they might. You may have problems with nail issues that are related to the skin, like fungus. Okay, those things can happen. Like getting ingrown nails. All of those things, a factor of how the feet react to aging. Then you have orthopedic issues, which are bone issues, like the tendons and the ligaments perhaps don't have the same elasticity. So if a foot that's a certain size when you're younger, if that tendon is not stretching as well, then you might end up with an elongation of the foot, so it might affect the shoe size. Okay, you have problems with things like gout that are more common as you get older. You have, of course, good old arthritis. That happens. So those are things that would be more of an issue as you get older. And then there's the circulation, which is your veins and your arteries as a rule. Folks have problems with swelling, which can come from something as simple as an increase in salt intake, which causes the veins to swell in response to that.
Because you have fluid
retaining the fluid. It's going to be retained most in the most dependent part of the body, which is going to be the feet. So watching salt intake is very important. Elevating your feet when you're going to be sitting for more than 30 minutes is very important. And then there are lots of medications that cause dilation of the veins. How some blood pressure medicines work is by dilating the veins. So if the veins are dilated, they're in a dependent position, the fluid is going to accumulate there, okay? Arteries can also cause problems, usually pain. If you go for a walk and then you have pain as soon as you stop walking, that tends to be more of a problem, with the veins. So those are the two major areas. And then, of course, the nerves. You hear people talking about neuropathy. That's also very common, as you get older, from diabetes and sometimes just what we call idiopathic, where you don't really have a reason for why the nerves don't work as well, but they can cause tingling, can cause numbness, and they can just cause just a lack of awareness of where your foot is, as you're walking. So those are major.
just a few things that go on with the feet,
Just
right?
a few.
And that's the reason that we have a specialist,
Yes,
it being a podiatrist, that take care of our feet, right?
exactly.
Correct.
All of us are getting older. All of us can develop foot problems, and many of us do develop foot problems. Dr. Sardi, what do you actually do in regards to issues when somebody comes in and sees you and says, I've got a problem with my feet?
Well, like Dr. Bethel mentioned, unfortunately with aging, as it comes to the feet, you are faced with corn, calluses, hammer toes, bunions, and you name it. What I do is I manage all these conditions so that you don't have to go through life with this pain. You can live. Come to the podiatrist, to this medical center, we manage your pain, we manage your bunion, we manage your hammer toes, we manage your gout even, so that you can go on living. A couple of patients come to me asking, what do I do about my bunion? I don't want surgery, but I don't know what to do. I can help you get the proper shoes, the proper orthotics, so you're aligned better. Your knees, your hips, all of those things are connected together. It starts with your feet. Once you have balance in your feet, your posture is balanced more. So there are different treatments I offer when my patient comes in, and my goal is to make sure I manage whatever you have so that you can enjoy this campus more.
Great, very good. Well, summertime's coming up. Is there some things we should or shouldn't do in regards to our feet?
Yes. Don't walk barefoot.
Oh,
No, not at all.
not even in the house?
In the house, you can, but outside, no.
Okay.
And there's a reason why. Most of our community, we are predisposed now to peripheral vascular disease, diabetes, so that puts you at a higher risk. Walking barefoot, even though you may prevent smelly and sweaty feet, you are predisposed to a higher risk of conditions such as warts, infections, getting a cut. And as we know, as we age, it's harder to heal. So while the young folks may be out there running barefoot, and while that may be something that you used to do, it is advised that you don't do it. However, if you're at home and you want to relax, you can. But just to be safe, it's advised that you don't do it. Another don't is flip-flops. No, they're not an option for you. If you're not on the side of the pool, if you're not at the beach where you want to wash the sand off your feet, flip-flops are not an option. And once again, we are concerned about your balance. What flip-flop does is it causes you have no support to your feet.
Okay.
She mentions you have a loss of fat pad.
Right.
So you have no cushion. So if you wear flip-flop for a prolonged time, what you're doing is actually causing pain to your heel, and that transfer to your ankles, and that transfer to your back.
Because you just keep on pounding that.
You just keep on pounding that. And you also have the risk of falling. Our balance is not as it used to. So as far as shoes, if you can get a great sandals, you want to keep your feet open, forget about flip-flops, and good sandals with a hard surface, rubber, that will provide that balance for you, or maybe a tennis shoe. Nowadays, they're producing tennis shoes that are actually soft and porous, and your feet can breathe as well. So you definitely do not want to do flip-flop. You don't want to walk barefooted.
Okay. And you said about the tennis shoes, you really want to keep your feet dry, right?
Exactly.
In the summertime.
Exactly. Okay. So another thing is, if you're going to wear tennis shoes, make sure you get cotton socks that are very thin, and make sure they are 100% so that your feet are dry. Don't get anything polyester or slippery socks during the summertime, because that's going to cause between your toes to be moist, and you don't want that.
Yeah, one of the things that always concerns me is I've seen residents walking down the hallways in their socks, and I've always thought, ooh, they're really taking a chance, because you have no idea if somebody's dropped a pen in the hallway or a piece of glass or anything along those lines. So, so they need to put shoes on, right?
Correct.
Okay, all right. So no barefoot.
No barefoot.
Okay. No flip-flops.
No flip-flops.
What about sunscreen?
Use sunscreen generously on your feet. I find that the feet is forsaken when it comes to sunscreen, but you want to use sunscreen on your feet as well, because your feet are susceptible to sunburns as well. So use a generous amount.
Okay. Any particular PF in regards to it?
15 or 30 is
Okay.
fine.
All right, okay. When I grew up in the South, I grew up in North Florida, and I used to get ringworm on my feet. Do we still have that problem today?
Not as much, but it can happen if you're walking barefooted
Okay.
around the pool, around the gym, even around on the beach. So
okay.
you don't want to do that.
Yeah, I just wondered because I haven't heard about it, and I mean, we didn't have shoes when I grew up. I mean, you know, in North Florida.
Oh, please. Sure, Claire.
But we did have a lot of blisters. Yeah, and what do you do about blisters on our feet?
Now, unfortunately, with the hotter weather, blisters are common. So what you want to do is leave it open. The myth is that you want to pop it, you want to put Band-Aid over it. With blisters, leave it open and let them resolve on its own. If it happens to pop, we're right here at the medical center. What I recommend is usually Silvadene, which will take care of it really quickly, and that's a prescription. However, if you cannot get to us, make sure you have an antibiotic ointment. But the goal is you want to keep it open. Do not close, do not keep it covered. That's only going to make it worse.
Okay, all right. And cracked heels. That happens as we age, right?
Yes, it does. It happens, and usually during the summertime as well. If you are a diabetic and you also have circulatory problems, you do not want to address cracked heels. Come to your professional, me or Dr. Bethel, and we'll help you take care of it. However, if you can take care of your feet yourself, I recommend get a file, a foot file, a pumice stone, or just a regular emery board. Soak your feet with Epsom salts and warm water, and just as you notice the cracked heels coming on, just brush it off and use the file, and then use a generous amount of moisturizing cream to help you
okay.
during the summertime.
So simple thoughts,
Simple,
right?
yes, exactly.
Just kind of common knowledge and common sense, I should say, not common knowledge, because we all forget how to do things at times.
Exactly.
But take care of our feet.
Take care of your feet.
Okay. And if we have problems with it, then call, make an appointment with you guys.
Come to the podiatrist. That's what I'm here for.
Okay. And Dr. Bethel, do I need to make an appointment through you to get to Dr. Sarti, or?
You do not.
Okay.
I mean, you certainly can. Your primary care physician can recommend an appointment with the podiatrist, but you can make an appointment totally separate from a primary care appointment. You can just call the same medical center number or stop by, and you can get an appointment with Dr. Sarti.
So 923-4644.
That is
got
it.
it.
Right, the medical center.
Absolutely.
I think I've been there a few times.
A time or two.
I think I've seen you there a few times.
Well, very glad that both of you came with us this morning. Is there anything else you'd like to leave us with?
Well, I think just the realization that having healthy feet is a part of your general health, and that we don't want you to neglect them and pay special attention to them, and we have lots of ways to help you do that.
Great. Thank you again so very, very much. And,
Thank you.
And we hope everybody takes good care of their feet and gets their Prevnar shot as well, right?
Absolutely.
All
Yes.
right. Thanks again.
Thank you, that's fine.
Don't go away, folks. We've got a roll in here in regards to the Scholar Ceremony, and we're going to come back after that and talk about philanthropy with Kimberly.